Hospital beds in the NHS have never been under more pressure.
It's just unrelenting at the moment.
With more patients to care for than ever before, and only 150,000 beds to go round.
It is a fast-paced job. There's a non-stop conveyor belt.
In this series, we use special cameras on beds in 4 very different hospitals.
Comfy bed.
To see the world through the bed's eyes.
Left at the lights.
As they share the most challenging.
Oh, it's coming again. Oh. Please don't get upset. I will look after you, okay? Are you okay, Ped?
Most intimate.
Nah, let's go.
And most rewarding moments of our lives.
You get in hospital and you go,
Coming up, in Birmingham, on day surgery bed 33, 70-year-old Christine's fingertip may have to be amputated.
But if the bone isn't too good, be thinking about taking it off.
In Barnsley, on resus bed 2, doctors fight to save 27-year-old Jordan's lung.
Okay, bit of pushing.
And in Leeds, on paediatric bed 3, 6-year-old Olivia faces her fear of operations.
You gonna be a brave girl for Mummy today?
No.
Your bed's like an extra member of staff almost.
This is the secret life of the hospital bed. At the Queen Elizabeth Hospital in Birmingham,
Oh, let's go, sister.
the day surgery unit has 81 beds, caring for up to 100 patients a day. These beds work under pressure, getting patients through surgery before moving to the next on the waiting list.
The lists are so long everywhere. People have been on the wait list for weeks, months. So we just try our best to try and get patients in and out.
Everything's all good.
Day surgery bed 33 is being prepped for its first patient of the day. 70-year-old retired cleaner Christine
Socks.
has come in for an operation.
I'm all prepared.
She developed complications when a splinter in her finger went septic.
I sawed a little bit in, so I got a needle, flicking it out. Within 2 hours, it was like a big green plum.
You're very accident prone.
I know.
Very accident prone.
Best friend Janet is supporting Christine today, as she may need to have her fingertip amputated.
They're gonna put a screw in, or if it's really bad, take it off to there.
Christine left the infection untreated, causing permanent damage and pain to her finger.
I mean, look at that to that. Something's not quite right there. So I should come out with a new finger, or no finger.
Day surgery bed 33 is now cleaned and ready.
Okay, sweetheart.
Good luck.
Yeah, thanks,
Okay.
darling. Yeah, all right.
And
then.
I'll be
See you
waiting.
later.
I'll be waiting.
You sure you're
here.
okay with that?
Yeah.
Yeah.
Nurse Russell will be taking care of Christine today.
There you go. That's fine, thank you, because I've got a bad back.
Okay.
I've got a lot of problems, ain't I? You got any children?
Yes, I have 2.
Oh, have you really?
2 boys.
There's only me at home with the cat, the budgie and the fish.
Have you ever had a stroke?
No,
And you're not allergic to anything?
not as I know to, no. Only men.
Do you smoke at all?
No. A drink.
How many glasses?
I ain't telling you.
Oh my God.
I have a whiskey and lemonade every night.
What does that taste like?
It's lovely.
Nice to meet you.
Yeah, you too, love.
Hope
See ya.
everything goes well.
Thank you very much. Yeah.
Bye.
Bye-bye, love.
She's hilarious. Just a splinter. Now she can't bend it, and it's really surprising that she may lose it.
Christine's finger became deformed because, like 1 in 4 of us, she self-diagnosed rather than go to the doctors. Her best friend Janet is waiting in the reception area.
I'll be glad when it's over for her. She's gone through enough. She really has. And we do look out for one another. We really do. But now we're good friends.
Christine's husband of 27 years died 2 years ago.
He was my soulmate. Can't get over it. And he was a glazer, you know. Do you know putty buckets that you put putty in? Well, I had one of them for his funeral. I had one made with all the flowers in, with Norman's putty on. And I brought it home, and it's in my garden. And I put little candles in and little flowers and talk to. Sometimes I kick it. Why did you leave me? I do. I do. You can't help it, can you? When it's a loved one like that.
After an hour and a half on the ward, it's time for day surgery bed 33 to take Christine to theatre.
Wagons round, eh? Left at the lights.
Negotiate this corner.
God. It is tight there, isn't it? Breathe in, please. Watch your feet. Die to bang, yeah.
We'll return later to find out what happens to Christine's finger.
I am a bit frightened. I'd just be glad when it's all done now.
In the heart of the city centre sits Leeds Children's Hospital. Its paediatric day surgery unit has 26 beds, caring for over 500 patients a month.
I've got 4 pre-op patients to admit. I've got another 2 acutes to go down as well.
These beds are with children of all ages, before and after surgery.
You coming to Mummy?
Paediatric bed 3 is waiting for its first patient.
We can build all the men up, can't we? Oh, look at this bed.
6-year-old Olivia has come in with mum Kathy for a biopsy of her bowel.
Yeah. Oh, look at this chair. It's more comfy than the other one. It's all squishy. She suffers with chronic constipation, and at the moment her bowels are extended, so they need to do a biopsy to see what it is.
During a biopsy, a small piece of tissue is removed so it can be tested.
We're going to build some stick men.
I'll show you how to do it. Yeah.
Olivia is one of around 100,000 children in the UK who suffer from constipation, but hers is chronic.
She's very bright, intelligent, aren't you? One minute you're really happy, next minute she can be a little madden.
Olivia's surgeon, Mr. Sugarman, will be testing for a serious underlying disease that would require invasive surgery.
There is one condition, which is a condition called Hirschsprung's disease. It's quite rare, about 1 in 5,000 births, so we try and rule it out.
Are you sticking your tongue out? Put that tongue back in. Just leave that tooth alone.
Olivia's been on bed 3 for only 40 minutes when something unexpected happens.
Oh, it's just fallen out. Your tooth's just fallen out. How cool's that? Here, use a bit of tissue to dab it.
While losing a tooth doesn't faze Olivia, she's developed a phobia of operations.
You're going to be a brave girl for Mummy today?
No.
Olivia's had to come to hospital dozens of times due to her chronic condition.
I was brave last time, remember?
That's because I didn't feel it.
Anaesthetist Dr. Guru Swami needs to decide the best approach.
I had a look at the notes from previous anaesthetic. It looked like she was quite upset.
Yeah, she was.
Was she screaming out?
Yeah, she's screaming, yeah. I had to hold her.
You had to really hold
her
and then pin her down.
I mean, I think any kid would be scared.
Yeah.
Dr. Guru Swami has prescribed a sedative medicine to make Olivia more relaxed ahead of her general anaesthetic.
Are you going to do these medicines? Yeah. Can Mummy do them for you?
We have this problem all the time with the meds.
With Olivia flatly refusing the medication, she'll have to go to theatre for her anaesthetic without any sedation. Later, we rejoin bed 3 as the team try to get Olivia to theatre for a vital procedure. Barnsley Hospital in South Yorkshire.
5 minutes. OK, so we'll see them in resus when they get here then, please. Thank you, cheers, bye.
The A&E department has a resuscitation area with 6 specialist beds and life-saving equipment.
That sepsis man needs to come in here.
These beds look after patients with the most serious conditions.
You've got the sickest patients going to resus, and you need to decide, are they going to die in front of me now? Are they going to die in the next hour? And if so, what do I need to do?
27-year-old railway engineer Jordan has been rushed onto resus bed 2 with a potentially life-threatening collapsed lung.
It's a stabbing pain, but constant every time you try and breathe. Horrible feeling.
He's struggling to talk and breathe properly. He's been given gas to ease the pain.
I woke up this morning and my son jumped on my chest, which is popped along. He got upset. He feels sorry for bless him, he thinks it's all his fault. Him being 5, he didn't understand, he just kept crying.
An X-ray has been taken. Dr. Hickinbotham is assessing the damage.
You can see that there's a large rim of air around the lung, with the lung tissue here that's actually collapsed down. There's a good 5.3 centimetres there.
I can feel that left side of my chest is not getting air. Every time I'm breathing, it hurts.
Every year, more than 9,000 people are admitted to hospital with a collapsed lung. Left untreated, it can be fatal.
If it got to the point that the lung collapsed even further and it started compressing all of his heart and his lung further across to the right-hand side, then that can cause his heart rate to increase, but also his blood pressure to drop. His heart may stop as a result of that and require resuscitation. If that wasn't done in time, then he may die as well.
Doctors need to act fast and drain Jordan's lung. It's a risky procedure, requiring a steady hand as the pipe passes near vital organs and arteries.
It can cause bleeding into the cavity itself. And also, that left-hand side is his heart. Put some local anaesthetic in once it's all clean, and then put the drain in.
Dr. Reddy, who is a consultant, and Dr. Hickinbotham Senior, is keeping a close eye.
It's important to get your position right as to where the drain is going to be.
Just a little short stab. You're just going to feel that bit of pushing.
It is a very, very delicate procedure and quite risky as well if you don't do it properly, because there is potential to cause a lot of injuries in the chest cavity.
We'll return later to find out if the procedure is a success and Jordan's lung is saved. At Leeds Children's Hospital, on paediatric bed 3, 6-year-old Olivia is waiting to go to theatre.
Mum, look. So, are we ready to go?
Yeah.
Yay! Finally! Finally!
She's having a biopsy to try and find out why she suffers from chronic constipation.
Have you got SpongeBob?
Yeah. Oh yeah, let's not forget SpongeBob.
Doctors need to rule out a serious underlying condition, but Olivia is adamant she doesn't want the operation.
Now then, sweetheart, if you're walking, you need to put some shoes on.
You're going home? No, we're not going home, we're just going down.
We're just going to go down and see another doctor.
No, and then we'll go home.
And then you
Yay! Finally. I don't have to get an operation.
I think we do, Olivia.
No, we don't.
Paediatric bed 3 is left behind as Olivia heads to theatre.
Oh, my tummy's starting to go.
After 2 previous operations, Olivia's developed an intense fear of having a general anaesthetic.
Mum. Soon as we do it.
Olivia, right, listen.
Calm down.
Yeah, listen, Olivia. We're trying to do you some good, okay? We're trying to make you better, okay? Right, Mom?
Yeah.
What do you want me to do? Are you happy to hold that?
Yeah, I'll just have to, yeah.
You just lay and have a cuddle with Mummy.
Right,
Come on.
I'm not going to do anything with it. I'm just going to place it on your face, okay?
With the help of Mum Kathy, anaesthetist Dr. Guru Swami sedates Olivia.
Can you get the head down? Well done, Mom. Okay. Thank you. Shouldn't be too long.
Right, okay.
Half an hour was right.
That's great.
You okay? All right.
Yeah, I'm fine.
All right.
I know she's scared. I just don't like seeing her going under because it's just a scary thing, just seeing her eyes just droop back. That's what's worrying me the most. But I know she's in safe hands.
Surgeon Mr. Sugarman will perform the procedure, which will take around 45 minutes.
Can I have a swab, please?
Half an hour in, and the sample is taken.
Okay, you can have a stitch, please.
After 15 minutes, once her anaesthetic has worn off, Olivia is reunited with Mum Kathy.
Hiya. Here's Mummy. Olivia. Mama's here.
It's okay, darling. It's okay.
Well, the procedure went fine. We've got a nice sample. I hope I should be able to get a formal result. If she turned out to have this condition called Hirschsprung's, that would require a major operation.
Olivia heads back to the ward.
I'm all right now. She's back up here and settled. Just be glad to get home.
They'll have to wait a few weeks for the results of her biopsy, but for now, Olivia can go home.
Oh, we need to be let out, don't we?
Paediatric bed 3 is prepped ready for its next patient. Coming up on The Secret Life of the Hospital Bed. In Birmingham, on day surgery bed 33, Christine reports back to Janet on her finger up.
You could hear it drilling. I thought they was building me a fence.
On day surgery bed 40, there's concern about 39-year-old Helen's heart.
There's some very serious things it could be, and until you eliminate everything, you are worried.
And in Barnsley, on A&E bed 12, Lewis's wife fears for his life.
Oh, I love him to bits. If I wanted it to happen, I don't know what I'd do.
Back in Birmingham, at the Queen Elizabeth Hospital.
They all lovely. I've always said in there they're a different class. Thank you. Different class of people.
Day surgery bed 33 is carrying 70-year-old Christine back from theatre after an operation on her finger.
Yes, this is it.
And then again.
Yay! Home again. Home again. Back up the naughty corner.
You take care of yourself.
Thank you very much, and I hope you get home okay. Thank you so much.
Following an infection, the finger became painful and deformed. There were fears it would have to be amputated today.
I tell you, it was like a 60-minute makeover. I could hear them say drills, screws, then you could and clipping. But they wouldn't let me say. They wouldn't let me say it.
Surgeons managed to save and straighten the finger.
They did say I might have a little bit of movement in the top as well. So we'll have to wait and see. I've never seen anything like it. Want to see the bandage on here? Look at the bandage on here just for a finger.
What are you doing taking that off?
Look here.
Put it back on. You're not supposed to take it off
You're
yet.
not supposed to take it off yet.
You're not supposed to
Tell
take
her.
it off yet.
Smack her.
Sister Harris has taken over Christine's care on the ward.
I'll do your blood pressure first, and then we'll get a cup of tea.
Christine's best friend Janet has been waiting in reception throughout due to having a bad cough.
We've just got, I think, the same outlook on life, really. Don't moan about things. Just get on with it.
I think the friend might come in now.
I'll bring her in.
I was getting a bit embarrassed because her has asthma and she keeps coughing, see.
Oh, no.
I think she'll come down now.
I haven't noticed anyone who's coughing out there.
No, she might calm down for her now.
Is one of them teas for me?
Yeah,
Oh,
yeah.
yes.
Put this, if you're not going to put it round your neck.
Oh, thank you.
It's
Oh,
hurting.
thank you. But honest to God, Janet, you could hear it drilling.
Mm-hmm.
Then it'd say the drill. Then it'd say some wire. Then it'd say blow it. You could hear the bowel being chipped.
Yeah.
I mean, I couldn't feel nothing, but you could hear it. Then I thought they was building me a fence.
Yes.
Yeah, but they were lovely, they really were. Oh, but I got her some tea. I've just got her some tea. You know what I'm like with my left hand? I can't... Oh, gosh, Janet, that's better than a whiskey, that is. Love, that's better than a whiskey, that is.
Isn't she lovely?
After 5 hours with day surgery bed 33, Christine and her great friend Janet can head home, with Christine's finger still intact.
Keep it elevated, though.
Can't fault the staff here, what they've done for me. They're all brilliant. But the most of it is my friend. Has been golden. Wouldn't know what to do without her. Good friends. Better than all the money in the world is a good friendship. It is, yeah. It's a good job we got no money. Have you bought me a dudden?
I have. That means I'm going to crash.
No, good is it. Left?
Go on, left.
Thank you. Bye.
Bed 33 will soon be prepped ready for its next patient. Back at Barnsley Hospital's A&E.
What's his mobility normally like?
What size is it again? No.
Bed 2 in the resus unit is looking after 27-year-old Jordan as he undergoes a risky procedure to save his left lung.
Okay, bit of pushing.
His 5-year-old son jumped on his chest, causing the lung to collapse.
You've got the drain there.
Dr. Hickenbotham has to insert a tube into the chest cavity to drain the lung without causing any internal injuries.
With these, there's a different connector barrier.
It's not painful, it's just discomforting.
Dr. Hickenbotham is supervised by consultant Dr. Reddy.
So what Leon is trying to do is to get him ready to get the drain in so that the air can be removed from the chest cavity and the lung will expand.
As a trainee within specialty, within A&E, we have to get certain procedures signed off by the consultant body. Just a couple of coughs, sorry. Yeah, bubbling away and swinging. Yep, swinging nicely. It does make it a little bit more nerve-wracking having plenty of eyes on you, but thankfully it's gone in first time without a problem.
He's done fantastically well.
As the air comes out, to start feeling a lot better. And gradually, over today, that'll resolve. More and more air will come out.
Dr. Hickenbotham has successfully inserted the tube.
We're just going to put a stitch in, just so it holds it in place, and then we'll put a dressing over the top. Just keep it nice and clean.
My lungs really expanding now. It's just that slight discomfort.
His breathing should continue to improve as that air comes out and the lung re-expands from its collapsed form. We'll request a bed up onto the ward so that we can keep an eye, make sure that he continues to improve with a view that getting the drain out later on today. It is a risk that it will happen again, but the respiratory team will be following him up closely.
So when I get back home, I'm just going to spend time with my son. Make him feel a bit better, reassure him that it's not his fault. Things happen.
Once a bed is freed up on a ward, Jordan will say goodbye to resus bed 2. Back at the Queen Elizabeth Hospital in Birmingham, another wave of patients is due to fill up the day surgery unit's beds. With current NHS pressures, staff and beds here rarely get a break.
It's very, very busy. Today I've had a complete full board.
Nurse MacDonald will look after 17 beds and patients throughout the day.
So they've got a little bit of blood around their bowel. Yeah. That'll come off. That'll come off eventually, yeah. It is a fast-paced job. So it's a non-stop conveyor belt.
Day surgery bed 40 is about to meet its second patient of the day. 39-year-old speech therapist Helen has a suspected heart condition, which doctors are struggling to diagnose.
You nervous?
Yeah.
Won't take long.
She's come in with husband of 18 years, window cleaner Johnny.
We'll be in by 12:30 and hopefully out by about 3:30.
Get today out of the way.
Helen's had a heart monitor fitted under her skin to help doctors understand her heart problem.
Helen Thompson?
Today, it's being removed.
No, it was that one.
Day surgery bed 40 is now ready to meet Helen.
Yeah, thank you. Cheers, thanks. I can be nosy here. Let's see everything going on.
4 years ago, Helen's heart started to beat rapidly and irregularly.
They say what it is you have then, or
No,
it's just random.
Living with me.
At least you're honest about yourself, isn't it? He's very honest.
Helen was placed on tablets to control the attacks, but she still has symptoms.
Every day I have effects from it.
So in the morning, I have to go make the cup of tea, which isn't a problem. No, it's true.
You're so hard done by.
Yeah.
When she goes up the stairs, she literally
I
can't
get a
speak
breath.
at the top of it. She can't get a breath. Yeah, and that hasn't improved
Mornings are worse.
with tablets or anything, unless she's blagging me, just so she can stay in bed, and I get the cup of tea.
The least you can do.
Helen is unusually young to have a heart condition. Doctors have tried to rule out atrial fibrillation, or AF, a disease associated with increased risk of heart failure and stroke.
You wonder, you read a little bit on the internet, you think there's some very serious things it could be. And of course, until you eliminate everything, you are worried. At 34.5 when it started, it was a big thing. I mean, you thought, what the hell's going on?
Originally they wanted to rule out atrial fibrillation.
Still might be that, but I don't think it is.
No, I don't think it is
What
that.
trouble with that? You can only deter it if it's that, if you catch a major attack. And because she's been on the tablets, she hasn't had a major attack. So there's a bit of a catch-22 going on.
Atrial fibrillation affects between 2 and 3% of the population.
They say people with AF have got a huge chance of a stroke and things like that. We don't think like that. You know, we haven't been told it is that, so presume it's not that.
Helen and Johnny met in 1995. They got married 4 years later and now have 2 children.
Oh yeah, there. Yeah. Oh God, yeah.
Anyway, it should be me having massage. I'm the patient. He wasn't my type at first. Yeah, he wasn't my type. But now you're my rock, aren't you?
Oh, she's easy going.
I'm very chill.
That's why we're still together. It's true.
No one has to put up with him, that's why. When do you say no? I'm having major heart surgery.
Well,
I can feel a takeaway coming on.
you're getting nervous.
I'll be nervous when I go down there.
Oh, you're in good hands here, bub. aren't you?
I was nervous more about today, about having it out, than what I was it going in.
It'll be fine.
I'll be glad to get it out. I just hope it comes out as easily as what it went in.
Later, we'll find out how Helen gets on having her heart monitor removed. Back at Barnsley Hospital in South Yorkshire.
Okay. She's in, yeah, she's in cubicle number 3. Thank you, cheers, mate.
A&E bed 12 is being prepped ready for its next patient.
Can I count?
No.
Why not?
Because I'm not doing it. Ready, steady, slide.
83-year-old ex-miner Lewis has been brought in by ambulance after collapsing at home.
You're ready.
I'll see you later, you take care.
His wife of 20 years, Julie, is by his side.
His legs just went from under him and he's not well at all.
I'm feeling a bit better now because they've given me a few jabs and that. And wait and see what they do, that's all they can do. And I've no teeth in, she's got my teeth in.
No, I
Lewis has severe pain in his back from when he fell. Wife Julie is concerned about why he suddenly collapsed.
He got his walker outside at bed and he went over. Well, I can't pick him up, I can't do things like that. That walker ripped all his legs, you know, with screws on it. Anyway, I just pulled string, it goes straight through to Warden. And then come here and just wait and see.
Nurse Miller is looking after Lewis today.
I've come to do your blood test, is that all right?
That's all right.
And then I'm going to pop a cannula in. Do you know what one of those is?
What? No.
It's where we leave the needle in case we need to give you some medicine.
Oh,
is that all right? And then I'll come back and do an ECG afterwards.
All right, then, look.
Lewis had a serious bout of pneumonia a few months ago. Doctors fear it may have returned, causing his collapse, so they're running some tests.
Is that arm okay on here?
That's okay.
So, bit of a sharp scratch coming. Are you ready? Arm we're in. You've got nice veins.
I've what?
You've got nice veins. That's a nursey compliment, isn't it?
Yeah. Bet you never thought you'd be told that.
I like those,
We'll get these sent off and then I'll come back to do your ECG.
All right. Thank you very much.
At 69, Lewis's wife Julie is 14 years younger and has become his primary carer.
No, if you're hurting, you're hurting. You don't want to put pressure on doctors. Says they've enough on. I says, yeah, but you're ill. You know, I say you're ill. You need to have somebody. Oh, I love him to bits. Oh, take to happen. I don't know what I'd do. I don't. Honest to God, I don't. I don't. And he's always said, if you'll go first, I'll be following you. He says, so leave coffin lid open. Just close your eyes a bit. You might be feeling a little bit better if you do that. Hey. Hey.
We'll be back with A&E bed 12 later, as Lewis finds out what caused him to collapse. Back at Birmingham's Queen Elizabeth Hospital, 39-year-old Helen has been waiting on day surgery bed 40 for several hours. Husband Johnny is by her side.
Stop it. Oh, you're starting me now.
She has an undiagnosed heart problem and is here to have a heart monitor removed from under her skin.
Shouldn't be too much longer now, though.
But time's running out.
Oh, that hurts though. Oh.
If she doesn't get into theatre soon, Helen's operation may be cancelled.
Oh, you on or not? Oh, you on or not?
No.
Ideally, we need to try and get all the patients in. because if there's no bed for the patient gets cancelled because they need a bed to recover in.
Don't want one.
Good luck, darling. I'll be back here waiting for you. While you're asleep, think what you're preparing for dinner when you get home.
After nearly 4 hours on bed 40,
Okay, where did you go? You want to say goodbye now and then... Yeah, okay.
a space has become available for Helen in theatre.
Good luck, okay? See you when you come back. Ta-da. See you about an hour.
Day surgery bed 40 transports Helen down the hospital corridors to theatre.
Just a little bit nervous, but I know there's nothing to be nervous about. I can't wait to have a cup of tea. I've never gone so long without a cup of tea.
Cardiologist Dr. Megani is carrying out the procedure today.
You've not had any further episodes since then, have you?
I have my ectopic beats,
Yeah.
but I've not had anything major.
Anything different from the
No,
last time you
nothing
saw us? Okay,
no.
that's fine.
She's having a local anaesthetic, so will be awake throughout.
You all right?
I'm fine. I'm in good hands.
Helen's heart rate monitor is coming out, but her underlying heart problem has still not been established. Husband Johnny waits outside theatre.
The next concern is they'd like her off the tablets. I think by the time she's 50, what happens then? They said maybe, hopefully it will just stop happening, but I'm not too sure about that because she's very reliant on the tablets. I'm not going to think about it, and nor will Helen, so we'll see what happens. Simple as that.
The monitoring device is removed successfully.
You can see it here, it's just a very small scar.
Right, thank
That
you.
will heal.
It's not the most pleasant of things. It's
To be
just
honest,
all the
it's just-
pushing and pulling.
Yeah,
that's...
there is a lot of pushing and pulling. Often people say it's a lot harder to take it out.
Right, we'll be back. We're driving.
Day surgery bed 40 and Helen head back to the ward.
It wasn't that pleasant, I must admit. But it didn't take very long, so all done.
Here she is, back with me. Oh, yeah, right. You go okay?
She did great.
Well done. Good, brilliant.
Take care.
Thank
Cheers, Becca. And you, bye. Lovely. Okay, so what you got to do then? 10 days of keeping it strapped.
Yeah, and they said at least 5 days, no cooking.
No chance.
So no washing out.
Maybe today, that's about it.
And,
Have your cup of tea. Yeah, should I open them for you?
Half an hour later, Helen's discharged.
let's go.
Freeing up bed 40 to be cleaned for the next day.
We need to go and find the kids, go and pick the kids up from wherever they are.
A takeaway, I think, won't it? So I'll be home and chill and rest. Simple as that.
Yeah.
Back at Barnsley Hospital, A&E bed 12 is with 83-year-old former miner Lewis. He's come in with wife of 20 years Julie after collapsing during the night.
Just a minute, there's another one here. Oh, I'm sorry.
Lewis has a history of contracting pneumonia. Dr. Hickenbotham suspects pneumonia might have caused Lewis's collapse.
So Lewis was in fairly recently, where I ended up stopping him for a month and became very unwell during that period, and that's what's left him very weak. His white cell count is raised a little bit, which would suggest that there may be a bit of an infection starting, and as part of the investigation we decided to do a chest x-ray to see whether that would be a source.
Right, I'll get me bag.
Are you alright?
A&E bed 12 takes Lewis for an x-ray of his lungs.
Pardon?
She stood aside in your ear.
Yeah, I'm here with you.
Have you put your coat on?
No, I don't need my coat on, I'm not going outside.
pack you up here and then we'll take you in. I'll come in for you in a second.
You right, love? You puffed?
I'm a bit puffed. I'm all right. Move your finger.
Right, Mr. Ingham, we're taking you in for an X-ray of your chest.
All right.
He's a lot older than me, obviously, but age is just a number.
After 3 hours in A&E, Lewis gets his X-ray.
If he can come home, I like him at home. You know, I would like him at home.
What do you used to do for a living?
Coal miner.
You're a coal miner?
Yep.
Returning from X-ray, A&E Bed 12 and Lewis feel the NHS bed pressures firsthand. The department is chocker. Another patient has taken their cubicle.
Okay, so just place you here for a minute and I'll let Nessa know where you are as well.
Let me pull your jumper down.
After 15 minutes, Dr. Hickinbotham finds Lewis a room.
So we're just coming into this one, Lewis. There we go, we didn't get any bangs on the way through, Lewis.
No.
We'll try.
Lewis's results are back.
So your X-ray looks nice and clear.
Yeah.
Okay. Just your blood tests at the moment just show that you are a little bit dehydrated. But at the moment, we can't really find anything specific that's going on. But given what's happened this morning, with you having had your legs giving way and you've been a bit generally unwell, we've decided that we're going to admit you up onto our medical floor just to keep an eye on things and making sure that you're feeling spot on before we're getting back home.
I want to go on tomorrow.
Well, let's get you fixed first. Okay?
Don't you
as long as it takes, Lewis.
Yes.
Thank you, love.
Thank you very much, Doctor. He's poorly, else they wouldn't have kept him. And I want him to get him better. I do, I want him to get better. I'll see you in a bit, love. Ta-ra.
Lewis is transferred to an acute medical unit for observation, releasing A&E Bed 12 for its next patient. Our hospital beds have given us intimate access to the work of the NHS. Lewis ended up with pneumonia and was in hospital for 5 days. He's now back at home with wife Julie. Helen and Johnny are waiting to see if doctors can shed any more light on Helen's heart condition. And Christine's fingertip now has some movement. She and best friend Janet are still thick as thieves. The beds are now back on their wards, ready and waiting for their next round of patients.